Yet another COVID variant is spreading around the country and has been reported in Arizona. This comes as Secretary Robert Kennedy Jr., HHS Secretary RFK Jr., made massive changes to the CDC's Vaccine Advisory Panel. Joining us now for more on all this, it's Will Humble, Executive Director of the Arizona Public Health Association. Good to see you. Thanks. Before we get to all that other stuff, this measles thing, what do you make of this?
Well, so there was an exposure past the security point, as you just mentioned, in the airport concourse C and D.
Yes.
At Sky Harbor, that's Terminal 4.
Yeah.
And so Maricopa County is trying to find anybody who may have been exposed who's at risk. So the really take-home message for folks is if you're unvaccinated, or especially if you had your infant baby in concourse C or D on those days, that's something to really pay attention to. If you're vaccinated or had the disease like I did in the 60s, it's not a big concern.
If it's in the air, how long does it stay in the air?
It's super contagious. So, like, let's say I have measles during this interview and I leave, it's still going to be in this room 2 hours from now.
2 hours?
Yeah.
All right. That kind of brings to mind COVID and some of the past COVID conversations. How long is that in the air? Now we got is it a COVID variant, an Omicron variant? What do we got here?
Yeah, it's a new version. It's really the next iteration. I mean, what's happening is the virus is trying to stay ahead of people's immune systems, and so it mutates in a way to try to evade the antibodies that we've all developed through infections and previous vaccines. Importantly, the clinical presentation isn't any different, so it's not any more severe, it's not any more dangerous, but it is more contagious.
Yeah.
Every next version is more contagious than the previous.
Symptoms any different than the past?
About similar. There are more people reporting a really sore throat early on. That's about it.
What about current vaccines? I think this is called Nimbus. The current vaccines, are they going to address? Do they help Nimbus at all?
Well, so if you got like I got mine back in the fall of 2024, the last booster, so that provides some protection. There's going to be a new version of the COVID vaccine that comes out this fall. That isn't exactly 100% matched because this is so brand new, but it will provide better protection than last year's.
Okay.
Yeah.
Real quickly, are you concerned that people are just tuning this stuff out when it comes to COVID?
Well, to some extent, that's okay. I mean, it's nowhere near the risk that it was 5 years ago.
It's a good sign.
Yeah.
Yeah.
I'm not freaked out about that.
Okay, all right. Are you freaked out about what's happening in HHS?
Yes, sir.
Talk to me about it.
So, as you know, and everyone's heard, it was at the top of the show here, the Advisory Committee for Immunization Practices, which is it's an organization, it's really a committee that advises CDC on vaccine recommendations. Mr. Kennedy got rid of they don't get paid a lot of money, so I can't say fired, but they were all dismissed, all 17 members of that talented committee. And then that very next day, he asked 8 new people to come on to the committee, 4 of whom are like vehemently anti-vax. Like they've been around for decades. One of them works is on the board, but is on the board of this vaccine advisory. They put out misinformation about vaccines. Like these are not people that, in my opinion, should be evaluating, the risk benefit of these vaccines, which is what the ACIP's job is. The FDA does a separate analysis. They're the ones who do the first check of vaccines to license them, where the clinical trials happen and so forth.
So they basically, the folks that left, the panel that had the big change, they give vaccine recommendations.
Right.
And folks like me go on the air and say, here's what health officials are saying regarding vaccines, and you're saying these folks don't think vaccines work much at all?
Well, they have what's called confirmation bias, in my opinion, which means like you just look at the evidence that confirms what you already believe, which is not what science is all about. You're supposed to look at all of the evidence and then make a new determination using the fresh evidence. And so yes, but I want to make a certain point here.
Yes.
It's not just the recommendations that are important. The health plans, your health plan, my health plan, Medicaid, the Vaccines for Children program, they only pay for vaccines that are recommended by CDC. So first is the licensure with FDA, but how you get that, how that vaccine becomes accessible is if your health insurance plan will pay for it. If it's not recommended by CDC, then they won't pay for it. So in my opinion, that's what Kennedy's trying to do. He's not going to de-license these vaccines because he'll get sued. He's got to tell his FDA to get rid of these licenses. What he's going going to do here, in my opinion, is take the ACIP, get rid of the recommendations, then get the health plans to not cover them. Then you lower the uptake of vaccines without pulling the license for the vaccine manufacturer.
Impact on vaccinations in the U.S. What's going to happen here?
Well, remains to be seen. Like nothing yet. But when you look at who's on this committee that's going to be making the recommendations to the CDC in the future, I expect some of them will be pulled from the list. I think the first one he'll go after is Gardasil. This is a vaccine that prevents cervical cancer. And he's been against that vaccine for a long time, and now he has the power of the state, and he'll be able to, in my opinion, I think he's going to take that off the list.
You mentioned insurance. What about Medicare and Medicaid?
The same thing. Right. Now, state Medicaid agencies like Access, they could decide, let's say they drop the Gardasil vaccine. Access could actually say, okay, we're going to pony up the money and pay full freight and not accept the federal dollars for this vaccine. That's a state-by-state choice.
Last question. RFK Jr. has said and is saying again that vaccines, these vaccinations that he's talking about, these vaccines, they are not even subject to placebo trials.
Thank you for asking that question, Ted, because that's bogus. It's hogwash. He has to know that. It's not true. The phase 3 of these clinical trials take thousands of people that are either administered the vaccine or a placebo. They follow those populations over time. Vaccines are not licensed until that full phase 3 trial is done. Then they go to a phase 4 trial post-marketing and look for things that, now you're in the millions of people, not thousands. So they look for things after that. And I just wrote a blog about this whole thing. It just irritates me when I see the Health and Human Services Secretary say things that are just absolutely blatantly not true.
All right, Will Humble, Arizona Public Health Association. Got it off your chest. Good to have you here.
Thanks, Ted.